Holland, plastic surgeon in Toronto, Canada, and this webinar is on the Fractora fractional skin treatment and technology. I'm a plastic surgeon located in Toronto. My practice has been entirely devoted to aesthetic plastic surgery since 1997, and I own two medical spa clinics in which non-invasive and minimum invasive and ablative treatments are the mainstay of revenue. My practice is about 70% body, 70% face, and 30% body, and we do a lot of non-excisional aesthetic procedures. Invasics is a worldwide manufacturer. It's been around since 2008. The principles are the same principles that were involved in the genesis and growth of Energy Systems Corporation, or ESC, and the early intense pulse light technology, which later became Luminous. Also developed, grew, and took Syneron public, and then formed their own company in late 2007 to form Invasics, which began as a technology company totally devoted to making the best radiofrequency-assisted liposuction and lipocontouring devices in the world. There's about 300 body-type systems worldwide now, and there was a recent FDA approval on its non-ablative radiofrequency energy applications, and that's what this webinar is about, some of the exciting things that you can do non-ablatively on this platform. Medical Advisory Board, well-known plastic surgeons both in North America and worldwide. If you look at the global market forecast, even in this difficult economy, aesthetic plastic surgery and cosmetic treatments have grown in double digits, 24% over the worst years the North American worldwide economy is known since the Depression. If you look at the technology, the capital equipment growth sectors, and you back out injectables like Botox and soft tissue fillers, anything that deals with skin tightening, skin texturizing, and body shaping has also grown in almost 20% combined annual growth. So these are the two most exciting and important opportunities in the capital equipment space: skin tightening, texturizing, and body contouring, including cellulite. If you look at the anti-aging opportunity, anti-aging really encompasses those technologies that improve skin tightening, both face and body, skin texturizing, pores, and is done without surgery, without excision. For every one person that might be interested in a surgical procedure, there's easily 10 to 20 people that are interested in a non-excisional solution. The Fractora concept is really based upon a radiofrequency energy-based system. The Fractora concept is a non-invasive body and skin ablation technology. The Fractora does fractional radiofrequency skin resurfacing as well as skin rejuvenation. It is not just, in other words, a skin resurfacer. It's a skin rejuvenator. And we'll talk extensively in this webinar today about fractional RF resurfacing in the Fractora, fractional RF non-ablative skin tightening, and then an exciting non-ablative fat reduction technology and cellulite improvement technology called TightFX, all in the same platform. So a very functional multi-applicator platform. The Fractora tips, generally the tip most widely used is the 60-pin tip. Each pin is 600 microns long. The spot size of each pin is 150 microns in diameter, and there are 6 rows of 10 pins for approximately a 5 to 10% epidermal surface coverage. If you look at the fractional world, we have the prototypical gold standard now would be fractional CO2 resurfacing, which delivers a cone-shaped ablative lesion, epidermal dermal ablation in a cone-shaped lesion. The erbium and YSGGs are less ablative and more less thermal ablative and vaporization are more coagulative in nature. And then we have the fractional radiofrequency needle-based technologies. Syneron's fractional electrode technology called the E-matrix has very little epidermal impact and a very broad subdermal non-ablative heating, which has been termed sublative. There's a product out of Asia called Intracell, which has coated needles with very little to no thermal epidermal superficial dermal impact, and the uncoated tip of the radiofrequency needle releases its ablative energy in the deep papillary and reticular dermis. Fractora is very unique. The pin itself gives you a tunable, variable ablative injury with epidermal dermal disruption and vaporization in the zone of non-ablative but irreversible coagulative necrosis, and then a wide range of subablative heating. So Fractora combines the best of the infrared fractional CO2 and erbium in a tunable fashion superficially with a deep subablative, non-ablative tightening, much like you get with the E-matrix. So it combines CO2 with fractional sublation for deep tightening and a variable and tunable amount of superficial ablation depending on the patient needs. How does this happen? Well, when you look at the sagittal view of the Fractora applicator, you can see the tip has 6 rows of 10 needles. Each of those needles provides an ablative effect. It can be a strong carbon dioxide type ablation with a very wide cone-shaped zone of vaporization, a zone of irreversible necrosis, and then a non-specific zone of heating. But at the end of that ablative experience, that radiofrequency needle tip does not stop. It sends radiofrequency current to the side electrode, the sidebar, which is negatively charged. And there's a rich dermal matrix of RF energy that travels between each pin and the side electrode. The closest pins to the electrode give a superficial papillary, non-thermal, non-ablative tightening, and the more central pins travel deepest, again, RF energy traveling half the distance between 2 electrodes. So at the end of a Fractora pulse, you get a superficial epidermal dermal ablative injury up to 600 microns deep, 100 to 150 microns wide, and then a tremendous zone of non-ablative, subablative heating. So you combine ablative and subablative in the same pulse form. You can control, by controlling the amount of millijoules per pen, the width and extent and depth of the zone of vaporization and coagulation. And you can control the depth and breadth of the zone of sublation merely by altering the millijoules per pin. Because the fractional RF has a non-specific, non-chromophore-based attractiveness, it will have effects on the vascular tone and vasculature, on dyschromia and brown spots, and on dermal collagen and water. You get a triple ablative, coagulative, and a subnecrotic heating of the dermis, or sublation meeting ablation. The benefits are a fast, effective, uniform, and safe treatment. When you look at the histologies on this combined ablative and non-ablative effect, you'll see typical ablative craters, as you would see with any ablative CO2 type device. And you get the zone of vaporization, coagulation, and non-specific heating. The big difference is that the two injuries, the ablative and non-ablative, the positive electrode sends energy to the side electrodes, and the entire dermis experiences a non-ablative, subablative effect for additional dermal heating and tightening. So post-treatment, you get reepithelialization and remodeling, as you would see with any ablative technology, but you get a tremendous amount of deep papillary and reticular non-ablative dermal or radiofrequency heating and tightening. The Fractora has a triple effect, collagen and elastin, but those electrodes that are adjacent to small venules and small arterioles, like you see right here, you will get a coagulative effect on the vessels. No carbon dioxide or erbium does that. They tend to leave bleeding in the field. This will have a coagulative effect. So after treatment, you actually see the vascular tone on a rosacea patient go down. You can see small telangiectasias improve, whereas an ablative laser device, you'll often need to do multiple long pulse YAG or intense pulse light or pulse dye treatments after fractional ablation. This Fractora will reduce the vascular tone. Superficial epidermal and dermal melanin, dyschromia, will also be improved. So you get tightening, texture, reduced vessels, and reduced brown spots. Sort of an IPL and a YAG meets a fractional ablative device and a subablative tightener. So what are the indications for a Fractora fractional RF rejuvenation? People with wrinkles, people with acne